To save bandwidth on the call, please turn off your camera and keep yourself on mute unless, of course, you are speaking, asking a question, or presenting. Most of us here speak in Hindi or English, so feel free to speak or answer questions in whichever language you are more comfortable in. We're quite mindful of having these sessions focus on a question and discussion session towards the end, and we usually dedicate ample time for that towards the end of the session. So please feel like hold on to your questions. But of course, if there's something urgent you'd really like to kind of say or comment, feel free to use the chat box quite liberally. And it would be great if you could sort of introduce yourself and your organization along with it when you like sort of ask a question or pose a comment. So it's easier to sort of contextualize where you might be coming from. I just quickly like to have a look at the broad agenda. So we're at the introductions of about 5 minutes, after which I'll hand it over to Astha from the Aapti Institute. And then as promised, we have about 25 minutes for question and answers. And I just maybe like to contextualize today's session a little bit more. So as a network, we have been exploring data collaboration and learning from others about how they're using data in their work in new and innovative ways. This has also been going on in some of our working groups where we've had evidence synthesis in the FLW's group and measurement harmonization in the food security group. And we felt that, a sharing of data is becoming increasingly relevant and happening at a rapid pace, but there are not really any clear directions yet of what this sort of sharing needs to look like or what shape it might be taking. So we thought it would be a great opportunity to bring in Aapti's work and for us to talk about the role of data stewardship and thinking about how what the future of data looks like, and especially in the community related to sort of COVID-19 work, where data seems to be sort of a very important commodity as we move forward. So just a brief sort of history of CoreNet over the last year now. Actually, we have about 55 member organizations working across 23 geography, and we have 80 submitted research projects on the web platform. We have more than 200 individual members on the Slack workspace, and we have a series of ongoing public and member-only events, of which the CoreNet Coffee Hours are the ones we host every month. We'd also like to take this opportunity to just talk about the CoreNet conference, which we're hosting in April. The dates are still a little bit not yet set in stone, but of course we will share all details that we do have as that happens. So we're hoping for CoreNet conference to be 4 days of learning and exchange, not only within the community, but with a larger set of stakeholders. We're hoping for researchers and foundations to kind of come together for plenary sessions, workshops, roundtables, speed networking, and very exciting performances as well. So just a brief look at where we are right now. We're on the 18th of March. We're hoping to have a sort of a curtain raiser event to kind of announce the conference and have maybe kickstart the first set of events. The 25th of March is kind of commemorating the day of the nationwide lockdown. So we thought that would be quite an app day to kind of announce the CoreNet conference and see, what that happens. Just as I mentioned, these dates are not set in stone yet, but we will definitely confirm what the final dates are as and when they're confirmed. Just a little bit of context about the CoreNet Coffee Hour sessions. They're hosted once a month, every Thursday between 4 to 5 for us to for sort of CoreNet members to convene informally, to discuss, share, and learn from work that other members are doing, to learn about tools, methodologies, different processes that organizations are using in their work. And we'd like to emphasize that all of these sessions are co-created with the members itself. So if you'd like to share your work or exchange ideas or just host a session where you'd like to talk about something that you find very fascinating and you'd like to share the room with other people, feel free to reach out to us at hello@corenet.in, and we'd be happy to kind of co-create a session where you could propose where you'd like to host that sort of a session. And with that, without sort of any further delay, I'd like to hand it over to Astha Kapoor, who's the co-founder of the Aapti Institute, to just walk us through some of the very interesting work that they've been doing over at that organization. And I will just stop sharing my screen, Astha.
Yeah, thanks so much, Nitya. And while I pull up my screen, I also wanted to introduce my colleagues, Siddharth and Saujanya, who are also on this call. We've been working together to build this work on data stewardship in the health sector. And while I will be the one presenting. They will take a bunch of the questions as they come. So, so yeah, I'll quickly start. So, just a quick word about Aapti Institute. We were set up in 2019 to examine the intersection between tech and society. And we've been looking at it from the perspective of the lived experiences and how people negotiate with technology, both online and offline. This work is situated in what we call the Data Economy Lab, which is a space to think about responsible data sharing. How do we, extract more value from data while safeguarding rights? And we've been supported by a media network. We have an engagement with Rockefeller that's helping us push this work forward. So I'll jump into it. Data stewardship is a new concept, but before that, I think like just a quick word on just our data lives as individuals going through the health system. We produce a lot of data in every interaction with the health system, and this is of course a very broad snapshot. But the idea is that right now we don't have full control over the way our data is being extracted, and because we're in an unequal relationship with healthcare providers invariably, and also in a lot of instances with researchers, we tend to part with a lot of data quite willingly. But the thing is that data, if harnessed carefully, if used in a responsible manner, can generate a lot of value. So it can, reduce the need for repeated diagnostics. It can add efficiencies to the sort of patient journeys. It can improve access. So I think that it just, as we think about stewardship, we have to think about it from the perspective of the value it generates to the broader group of stakeholders. And we believe it's data sharing in a responsible manner is valuable not just for users, but also academics, providers, civil society organizations, and of course the government that is looking to make evidence-based decisions. So we think that the idea of stewardship, which I'll come to in just a second, is part of a longer journey. We are, of course, at the bottom of the ladder at the moment, in a certain sense, where there is a growing realization that data needs to be made more accessible, but it's often done through opaque agreements without proper consent, anonymization. Anybody who has been to a hospital recently, and I've been noticing this a lot, like consent mechanisms are quite weak. And like I said, individuals don't necessarily have a role to play once they are in the health system. They just sort of become subjects. But we're thinking about moving that a little bit. And the process to do that, of course, is through data governance, which has started to happen. So we have new laws coming up with the personal data protection bill. We're waiting for that. There are also, things happening on the NDHM, the National Health Data Mission, that's also coming up. So there is some activity happening about how do we regulate data use and data sharing better, but that to us is not a sufficient outcome. We believe that data stewardship is where we should all be heading, which is to be able to unlock this value while safeguarding rights, while giving users a seat at the table to enable them with better decision-making tools. And we think that, data governance, of course, is an ideal situation where everybody is compliant, and data stewardship is where we aspire to be, where there's accountability and agency enhancing mechanisms for sharing and governance. So I think at the moment, I've got the arrow a little bit higher up. I think we're closer to between sharing and governance, where there is data sharing that happens, but it's not very well governed. And where we want to be is possibly between governance and moving towards stewardship. So a quick view on, I've been using the word stewardship, but what does it really mean? So on the left, you'll see that data sharing is largely, terms of consent are restricted to the processor at the initial collection. So it's some form that you've signed, and terms of sharing are not necessarily communicated to people. Their standards for interoperability exist, but they're not optimized for user consent or federated access control, which basically means that, it's likely that a hospital A and hospital B have decided to forge a data sharing agreement and have made their data usable, but then that's the only sort of loop in which that data exists. And it's also restricted within sectors, within providers, so it's quite siloed. So we were talking to somebody at IIIT Delhi who was saying that Max Delhi and AIMS actually don't have a way to speak to each other when it comes to data sharing. So they're actually trying to build this out, which is quite incredible, because even as we live through this global pandemic where we've seen the value of data sharing, whether it's on innovation or access or actually preventing the spread of the virus, systems in the country haven't necessarily learned how to do that well. Meanwhile, stewardship is a framework for implementation of user consent beyond the initial point of collection. So how do we make sure that the user is involved in whatever manner that they want to be in the process of data governance and sharing? It also allows for collective bargaining, and it means that there's a lot in there, but basically, we're increasingly realizing that data is a relational good, which is that data about women in India impacts me. Similarly, my data will impact broadly the women in India. And of course, this is a very large example, but even in our communities, in our ecosystems, we know that data is increasingly a communal good. But also the other thing is that as we negotiate, whether it's with platforms, or social media platforms, tech platforms, or whether it's with healthcare providers, we as an individual have a much harder time negotiating as an individual, because we have no power or agency. But stewardship allows us to collectivize in certain ways, and some models of stewardship lend themselves very well to that collectivization, where we can negotiate. And we'll come to some of these examples later in the presentation. The other thing is standards following policy decisions and enforcement of user restrictions on duration, on purpose. What is my data being used for? How long will you have it? Making sure that the purpose that you've stated is the purpose that it's being used for. So making sure that is there, and also making sure that it's not just broad access. The data has just been collected and it's just sitting there, but there's a clear, specific, enforced purpose. We've been actually thinking about how do we take this esoteric idea of stewardship to reality. And the way we've been doing that is by actually talking to people who've been building models of stewardship. So while our broader work, we've spoken to, over 50 models, but in the health sector, we've spoken to about 20 health data models. So the objective is to first disaggregate value, because people will only share, whether it's individuals or healthcare providers or even the government, will only share once there's an understanding of value. Then, of course, the stakeholders of people who will be involved in this data sharing ecosystem, people, actors, and then the models of stewardship that lend themselves to certain kinds of value is what we're trying to do. And I know that this is a pretty circuitous framework, but it's a complex field because, value still remains quite high level, and we're trying to translate that into actual decisions people can make on the ground as researchers, as academics, as civil society organizations, as we think more critically about stewardship. Then there's the purpose, which is the stated purpose of why a stewardship model exists. And then, of course, the governance and design choices that go with it. So quickly, we've tried to disaggregate value in the health sector. This is, again, at a high level. We think that academic and research, sort of epistemic value is a big part of it. Improving access to healthcare, expansion of healthcare services, governance and transparency, which of course is a byproduct of a lot of these things. But we think that, that's a huge value that data sharing can actually bring about, because the government will be forced to, communicate their decisions better, to be more transparent. And then user agency, which of course has an impact on, 2, 3, and 4 most definitely, but also 1, that users will, like I've been saying, have a seat at the table and will be able to decide how their data is being used and not used. So, and I realized that we've left out commercial value from this, and that is almost on intention, because each of these sort of buckets can lend themselves to creating commercial value, which is like, you could be monetizing your research. Access to healthcare, of course, like, is a business, as is expansion. So, we think that there is commercial value embedded in it, but we have deliberately taken a step away from that, because we're trying to understand societal value. And Mariana Mazzucato has a really interesting public value framework that is worth referring to in this. So as we go from value, stakeholders, of course, everybody knows, there's providers, public institutions, civil society, the individuals and communities, obviously at the heart of it. And then the stewards themselves, which is not a layer that exists at the moment, but we hope that that's something that will evolve in this ecosystem. Now, this, of course, is apologies for how dense this is, but basically what we think stewardship can do is 2 things. One is, of course, as I've been saying, increase user agency and participation. And then the second is, broaden the access to data. Now, these are on the left, you'll see are the stakeholders that are involved in the ecosystem, and in the boxes are possible models, and I'll explain these models as we go along, and also through examples later. Now, personal data stores are basically, sort of data wallets that give individuals significant amount of control. And, there are examples that have been coming up in the health sector as well. Clue, which we'll talk about later, is one of those. Data cooperatives are governance systems that allow individuals to come together as a community and decide on how their data is going to be used. Data trust is possibly something that a lot of people may have heard about. It also made its way into the NPD report, is to have a delegated fiduciary part, sort of deciding on behalf of data principles. And exchanges and collaboratives are, broad partnerships on data. They are governed based on the rules of the partnership. So these are some of the models that we've been exploring. And we think that for individuals and communities, the main objective is to enhance agency. So therefore, models that lend themselves more to agency enhancement, such as PDS and data cooperatives, work better. Trusts, of course, are also a model. The reason it's not highlighted, because right now it's sort of like an urban legend. We're trying to figure out whether it's real or not. And similarly, like healthcare providers might want to, be band themselves as exchanges or collaboratives. Public and government organizations as well, those might be helpful models for them. And then nonprofits, I think that, it's interesting because nonprofits have a very critical role to play in questions of data, because they are both, resilience, resistance to the data extraction process, as well as a way for people and the community to negotiate better. So there are several models that can be attributed to or that can be helpful for the nonprofit sector to think about as well. So just as I said, like, just a quick overview of different types of models. So I already mentioned cooperatives. This is Me Data. It's based in Switzerland. It's a health data cooperative where data principals or subjects make collective decisions about what research their data is going to be used for, and in exchange for a remuneration. So it's a not-for-profit cooperative that is focused on aggregating health data to solve specific problems. So they've worked on multiple sclerosis. They've also built disease-specific platforms for COVID-19 that allows patients to log in their symptoms in an effort to promote citizen-driven healthcare. We have details on consent, but what's interesting is that
It's a multi-layer process for decision making that involves an ethical review board and a general assembly where all the members who are part of this cooperative can come and give a vote on whether or not their data is being used. We've also seen this very interestingly in in the question of labor rights, because that's also an area where people are feeling the need to come together to control how their data is being used and not used by platforms. The second one is the data exchange. This, as we said, is like the possibly the broadest, least users agency specific model, but it's a variant bio. It's a health data exchange that helps to drive again people driven research and develop therapeutics informed by data. So it's again a not for profit that's funded through grants. It develops therapeutic and diagnostic tools for communities which have been historically underrepresented. So they work a lot with the indigenous communities and try to see how their interests can be represented through research, and they combine different methodologies to identify the relevant populations and actively partner with them. And the power to make decisions actually here lies entirely with variant bio, and the communities are informed of the scope but don't have any control over it. So here the main purpose is not community agency as much as community led research, but the final decisions on the data lie with the variant bio. Then the next one is a collaborative, which is where people come together to collectively decide on how to share data. Again, it's a not-for-profit, aims to empower patients in their right to healthcare data, helps aggregate, standardize, and create portability. As I mentioned, that's a big concern, and facilitates patient data for sharing with doctors, for second opinions, research, etc. And the model is wholly revenue driven, with decision to share data being determined by monetary considerations. And there's an advisory board that vets proposals, which is a representation of all the communities that are involved. So, and then finally, I think personal data stores, Clue, which is actually a period tracking app that allows users to store their data on the application and consent to share it with researchers. This has a huge amount of like value in financial services. There are also like related data marketplaces that are coming up on personal data stores, where I as an individual can pull my data from different sources and sell it on a platform. Here is another model, which is perhaps the one that gives the most amount of control. Like I said, data trust, we're still discovering these. There's a lot of enthusiasm around them, but the reason we're a bit skeptical is because we haven't seen them in the wild. Sage Bionetworks, which is also a non-profit that works on researches on health, we think has the best sort of example of fiduciary responsibility led decisions on data, and that's why we think that this might be a trust, but the way it's defined at the moment, it's all up in the air. The final slide is what's it called, on the best practices that define a good steward in the health sector. We think that availability and reliability of data sets is critical. There's reduced cost of accessing data, which I think is a big one as well. Regular data audits, ethics, and assessments to ensure that any public interest questions are kept at the heart of the problem. Clear incentive structures. So why? Because data monetization is such a big concern at the moment, and health data, of course, because of all the pharma and insurance interest, lends itself very well to be monetized. So how do we really think critically about the incentives? Accountability and grievance. Anybody who is faced any kind of data leaks at the moment knows that they, whether it's through Swiggy or whatever else, that there's no way to get any kind of grievance. There's no way to hold platforms accountable for being callous with your data, and that's the same in whether it's hospitals or whether it's researchers. So how do we get greater accountability and grievance redressal? That's a big big feature of a good steward. Financial sustainability, which I touched upon. Stewards can't be entirely grant run. They can't be, monetizing and selling data. So it's a very thin line to think about as to how do we create sustainable business models for steward if they are indeed to survive in the wild. And then, of course, fundamentally is a community-centered approach. It should, by definition, be required to generate societal value. And that, of course, is linked to the purpose of the steward, which in turn defines all the decisions you make around it about consent, who do you share it with, how do you, do you or do you not monetize data. So I'll pause there. Sorry for that, breathless presentation. It was a lot to get through. If there's any slide that you'd like me to jump into, then please let me know. And also Siddharth and Saujanya, if you wanted to add anything, that would be good.
We could look at some of the questions we got as well.
Yeah.
Great. Thank you so much, Astha, for that very detailed and comprehensive presentation, and also going through so much, but sticking to the allotted time, leaving enough time for sort of a great discussion and conversation. I see that there are a few questions that are coming in the chat section, though I do see some have been addressed. But Priya, would you like to unmute and ask your question?
Yeah, firstly, I want to thank Astha. Astha, this was such a brilliant, though short presentation, but totally an appetizer for a longer conversation. I'm thinking of so many spaces, and I'm sure Sunita would say the same, where we are trying to nest ideas of building data collaboratives amongst our partners, where a lot of these issues are coming up, but I don't think we have some of these frameworks, a clear understanding of these frameworks, especially some of the attributes around data stewardship that you talked about. So what I have a few questions on chat which you can get to, but actually my larger question is that it seems, even from talking to you earlier, the health space is a little bit behind maybe the financial inclusion space around this. So what does the health space have to catch up on, and what do people, our researchers, what should they be thinking about right now as the discussions around data are becoming so prominent in all our lives? So if you have any kind of advice, things we should be looking at, reading, thinking about, because we definitely want our research partners to be thinking in a more collaborative way around building data repositories, and a lot of the issues that you're talking about are relevant, but at a very different level. So any thoughts or advice would be very useful.
Siddharth, you want to go first?
Yeah, sure. I wanted to, I guess, address.
And also to the donors, Siddharth, since this is being recorded, we could share the recording. Yeah, please go ahead.
I wanted to, I guess, address the question of how stewardship fits into all this. And I think what needs to be agreed on first is a couple of things: what data is useful and how it's useful. And secondly, a kind of, not, I don't even want to say standards, but just a format of, once you know what's useful, if you can get a bit more specific about what data is useful and how that's valuable, then there might be some kind of common understanding that could be developed as to what data is required. And once you know what data is required, then you can ask questions of, okay, then what do we need to look at to enable sharing of this data? Because I think with our research, what we've found is that the kind of impact, the kind of incentives that are required for increasing data sharing can change depending on the context in which that data is already present. So making users, if you have a PDS, for example, a personal data store enabled, and you're encouraging users to share data through that, that might just look different in terms of what kind of initiative you need, as opposed to making, let's say, research organizations share data amongst themselves. So both of these, while kind of contributing to increased health data sharing and increased value, and because of the nature of data, the value is kind of enhanced because of sharing as well. All these aims would be kind of achieved in both, but the kind of things you need to think about for each of them could be significantly different. But just to answer the question again of what what might benefit, yeah, just that agreeing on what data is valuable in the first place, and what that looks like is a good first.
Yeah, and I mean, just to agree with Siddharth, Priya, I think that this is very much a sort of complex scenario, because at least based on all the research that we've been doing for the past 2 years, what we've discovered is that what to do is linked very clearly to the purpose or the value, as Siddharth said, and without that, all the other decisions are not entirely relevant. But as a foundation that is investing in a lot of sort of data driven and data led initiatives, as funders, I think that there's a huge amount of there's value in creating the ecosystem around sharing. So that means if there are health data sharing standards that can be developed for at least the ecosystem that the foundation exists in, so that it makes it easier for organization in Bihar to be speaking to organization in Andhra. Because right now, that's the other thing, is that we have data in so many different formats and so many different standards. Someone is using Excel files, sometimes there are data in PDFs. So even like, how do we communicate the data with each other, which is like an ecosystem question, is something that needs to be answered. And then I think that the other thing, which as researchers we all do our best to think about the ethics of the research upfront, but I think, how do we make sure that transparency exists through the process of the research? And also, how do we make sure that people or subjects of the research have a say in, have the ability to revoke consent? I know that all of this is said out loud, but like, how do we make sure that it's implemented better? We've been talking to, and I think I mentioned this earlier, is we've been talking to a cooperative that works with fishery farmers, and they have pond sensors and a lot of personal data, and they're trying to just create some kind of like a dashboard that allows farmers to see what data is being collected, where it's going, which third parties have been given access to it. So I think that even just transparency mechanisms in the early stages will translate to greater realization of the value of data more broadly.
Go ahead, Nitya. I think Malshri had some question, and there was another set of questions around citizen science. So maybe you can read them out, or
Yes, I think Molchi has unmuted herself. Molchi, would you like to ask your question?
Yeah, sure. Thanks,
Great.
Satya. So,
Thank you.
thanks so much for this presentation, and it was really great to kind of hear about what you're doing. And I think what I was thinking about is that a huge policy priority with the pandemic, and also generally from sort of the evidence base across different subtopics in health, is that there's a dire need to kind of strengthen health systems, especially public health systems. And from sort of our work in these health systems, we have found that data is stored in lots of different ways, especially a lot of it is stored on paper or in kind of inaccessible ways. So I was curious to see what kinds of policy actions or actions by other types of development sector stakeholders can be taken to I guess incorporate the agenda of data stewardship in the broader agenda of health system strengthening.
Hi, I'm Saujanya. Can I take this? Astha?
Go for it.
Yeah. So this is something we have been grappling with from the very beginning of this project. Yes, as you correctly point out, a lot of data, particularly in the public health space in India, is still on pen and paper. What is changing, however, is that we've been able to speak to a few models, a few civil society organizations who have, taken a nascent step towards forming their own platforms for data collection. So there's an interesting case is this organization we spoke to last week. And that person told us how they work with over, 400 communities, villages in Karnataka alone. And for that, they created their own dashboard for data collection. And they also work as technical advisors with the government. So they collect, they don't collect any data directly as much as provide a platform which allows community health workers to allow your Anganwadi workers to collect information, say malnutrition statistics in your local area, or anemia among pregnant women, and so on. And this data is then logged into the platform. And I see there was a question on training. All these frontline workers are equipped with training, and these dashboards are customizable, so they can move around the questions to suit their priorities in the local context. And this data is then analyzed by the technical advisor to provide insights. So this not only significantly improves workflows, but also in so many ways enables visualization and program planning and action. So that way, yes, there is incredible potential for strengthening the public health system in the country. And building platforms for stewardship is one way around it.
Also, to answer Babita's question on how communities can participate, in addition to what Sojana said, I think that there's a lot that can be done by civil society organizations in our minds, and also traditional communities. So to quote my friend Anouk, who does a lot of work on data stewardship and data trust, she says that data stewards can play the role of your doctor. They need to play the role of your union, and they need to play the role of the town hall, which I think is a really, really good way of thinking about the wide role that stewards can play. Because as doctors, you rely on their advisory support to navigate the data economy. As unions, they need to sort of come to it, provides you a platform to negotiate collectively. And of course, as town halls, it allows for transparency and accountability of platforms of the government. So I think that in all of this, there's a huge role for community-based organizations to start talking about the value of data, to start inserting these questions in every aspect of the work. And I think that unions in particular, because the other problem is that communities of data are not as straightforward as being in the same geography or going to the same university. So communities of data are very, very diverse. But at least in the health sector, it's possible to narrow it down to, here's your healthcare provider, and you have, for everybody that's going to a certain healthcare provider, you have a certain data steward that helps navigate questions of value, of privacy, of accountability. So I think that organizations that are working on the ground on health services would be a good starting point to start raising awareness on the value of data, and then also discovering models. And of course, like I said, we're trying to work with civil society organizations to help them through this journey as well, because more and more organizations are realizing that they enable a lot of data extraction in communities, and are increasingly aware of their role as the points of resistance.
I wanted to address, I think, the latest question, the last question from Sunita from Priya, on how to kind of operationalize this, how to operationalize stewardship. And I think it also speaks to an earlier question about stewardship in the Indian context. I think a lot of it boils down to a couple of things that Astha has already been speaking about in terms of community participation. And I think just on the legal side of things, and I come from a legal background, so there's no escaping the fact that we are still waiting for a personal data protection bill, and we're waiting for a non-personal data bill as well, for that matter, which is of immense significance to questions of community data. But part of those discussions are about building the blocks for data governance and building a structure around that. Now, a lot of these questions will depend on the decisions that the committees take on those questions. So, for example, I could say that I want good data governance to work through a data trustee, and a data trustee should be, for example, ascribed through geography or ascribed through sector or ascribed through collectives, like existing collectives, let's say unions or industry bodies and so forth. So I think it's an ongoing conversation. Sorry, I've just seen the new message
Oh,
in the
no,
chat about.
just finish your point. Sorry, we'll continue to write things on chat. Didn't want to interrupt you. Apologies.
Right. Okay, no problem. But yeah, I think we do have to wait, and it is an ongoing conversation, because in terms of just the governance structure around it, there are some open questions. The question of what a data trustee is an important one that people don't seem to agree on completely. The idea of even what a data trust is, for that matter, is not something that I know that even within Aapti we often disagree about what that actually means and what that implies, and like all the legal protections that should carry or should not carry, for example. And coming to the Indian context specifically, I mentioned those couple of policies. I think in India there is a need, as one of the questions also alluded to earlier, just to kind of have a literacy on this. When I say literacy, it's not just literacy of digital literacy, just the basics of machine usage, but also it's about having, I think, a degree of disclosures, which I think is very important. And when you share information, it's not just about data sharing, it's also about sharing information about the use of data. Explainability in AI, for example, is what this is all about. Telling people how their data is being used. Kind of really making people understand the impact of sharing data, telling people how they'll be impacted by the use of data. For like, this is something that EU's GDPR does quite well. For example, it not only requires you to if I'm a data processor and I share your data with a third party, not only do I need to tell you whom I'm sharing it with, I would have to inform you about the business details of that entity. I'll have to tell you about not only all the ways the data could be used, but all the ways that it could potentially impact you. Which is to say, I don't just tell you I'm sharing I'm sharing machine read information about traffic in your location. But if it is possible that shared data might actually result in policy decisions of let's say how the state government is dealing with the roads or dealing with kind of funding infrastructure in your area. If that's a possible outcome, then I'll have to tell you about it. That can't be left to chance. So making users aware as much as anything is, I think, like the basic part of moving forward with data governance.
Balaji, would you like to ask your question?
Sure, happy to. Thanks for the opportunity, and thanks for the wonderful session, Astha and team. So I think two questions. One is, basis your research so far and all the wonderful work you have done, how are you seeing the public healthcare service providers and the private healthcare providers engaging with this topic? And I'm assuming there is a distinct approach and there's a difference in how they are embracing this topic or engaging with this. So that's one question. Second is, given my background, which I put in chat, how can I best engage and participate and contribute to this community of practice?
So I think that just in the second part of your question, of course, like, it's a growing space. So at this point, we're all researching. If you have, access to community-based organizations or communities or the Year of Healthcare Providers, I think just spreading awareness and creating more knowledge on this space is very important. We as Aapti are constantly trying to, get together a group of practitioners and thinkers around this. So would be happy to also include you in that outreach that we do, or in that sort of community building that we do. In terms of how can healthcare providers engage in it, I think that, that's something that we are also trying to figure out. I think that there's a lot of willingness and need to share data, but of course, stewardship as an idea is
is quite it's burdensome, and it's possibly time consuming and adds greater frictions to the process of sharing, which is desirable in our view, but not always desirable in the view of entities that want swifter data sharing. So but I think that, if we are able to communicate the value of sharing and what that really means for all the stakeholders, we've also identified, ideas like the collaboratives, where you can come and govern your data collectively. So if there are, 5 hospitals in Delhi or Bangalore that want to share data on a specific disease for a specific time period and do so in a governance first way, then those are some inroads that can be made on data stewardship from the healthcare provider perspective.
Thank you, Astha. Really appreciate the responses. Thanks for welcoming into the community, and I really find those answers fascinating. I mean, this is an interesting space, and from little research what I have done, that there is certainly how there is a sizable difference in how a public healthcare service provider approach this versus a private healthcare provider, and there are interesting conflicts of interest and so on and so forth. So, but good to know. Thank you very much.
Astha, I wanted to also say that I'm thinking more and more about the fact, like, how do we build the ground up, like by educating people about, all of these issues. It's not about data stewardship, but like, what is data? Where all is it being used? What gets extracted? How? I mean, all the conversations that are happening right now. But there are many people who are unaware and therefore are not able to engage in these discussions meaningfully. So there has to be some language in which it's much more accessible, because how do we even build community models of data stewardship if we haven't kind of build the base strong up and like kind of made it easy for people to engage in this? So I don't know who is doing that work on what I would still say it's part of citizen science. Who are the people who are really committed to doing that, and are there any examples in India?
So I must confess that, the work on just data rights, if I may call that broadly, is still happening at the highest levels, at least in our minds. And of course, at those levels, organizations like CIS, Center for Internet and Society, Internet Freedom Foundation, which I think is doing excellent work. We also tried to, do some work on the idea of reclaim your privacy, where we wanted to educate people through multimedia on how to, just navigate platforms through phones and the internet more responsibly. But I must confess, Priya, that I'm not aware of organizations that are doing this work on the ground. Every time, like with regard to Aadhaar, and I know you and I spoke about this, it's just there are implications of being in the data economy that come to the fore every now and then organizations do work. So of course, the Right to Food campaign, Ajivika, Jan Sahas, these are all organizations that do a lot of good work when it comes to questions of exclusion and access. Seva, of course. But I think that really thinking more comprehensively about all of this as a data rights issue, that intersection hasn't necessarily been made, because I think that people think about it in the sectors that they're working on. So whether it's like access to services or health or education, but not necessarily as a comprehensive whole, which runs through every theme now, like every interaction, whether it's with the state or the private sector or Facebook or wherever else. So I don't think that comprehensive awareness building is happening on the ground at the moment. I can take that as well, Sunita. I think that, is there any discussion? Yeah, there have been some small discussions here and there, but again, they in no way do they trickle beyond the usual circles of concern. And I think that that's something that is obviously a big concern that we're also noticing, because like I said, that there's no way to to form a resistance unless there is greater awareness. And we've been likening this in some ways to the, labor movement, where there was a bubbling up from the ground and then regulations and, sort of like were forced to take cognizance. But at the moment, data is a much more distant and esoteric idea than labor. So which is physically experienced by people. But my hope is that, and like I said, we're seeing this in the context of, say, platform workers like Uber and Ola drivers, that are increasingly, there's a case that's happening in Europe where they have gone to court asking to port their data into a data trust from Uber, and using existing law sort of provisions of the GDPR. So as the law makes space for some of this, I think that we will also start to see a greater movement. People will soon, this is again happening, is that, insurance premiums being decided by social media profiles, all of those things that impact, I think, is slow to be felt. But as that happens, I expect that there's going to be greater public awareness and greater public action around this. I don't know if that answers your question. So broad, like the answer is we have to build a greater movement around data rights, I guess.
Thanks a lot, Astha and Siddharth and Saujanya. I think I have to quit to go to another meeting. This was really very thought-provoking. And Astha, I feel like I've seen, even in just, this is only the second conversation we're having, I can see that over the months between the two, that you've really advanced in the way you're articulating these issues and the groundedness that that I'm hearing now, as opposed to the first time we spoke. So, I really, I feel like there's a lot of food for thought that you've given us. And yes, what you just said about the place of public awareness within, the national discussions around these bills is also, it resonates. Maybe a lot more work that needs to be done.
Thanks so much for giving us the opportunity to articulate some of this. We've sort of been living in our heads, and that's why to discuss this with a community of practitioners has really been quite wonderful. So it's been quite a learning for us, and I'm glad that our work finds some resonance, because we are worried that it's a little bit conceptual and quite far away from the realities on the ground, where, like I said, we're still struggling to digitize things. But I think that this is definitely an area that we need to think about now, so that, like, in 5 years or 10 years, we can be more aware and be more sort of organized around these questions.
I just Astha, I also wanted to thank you all, but I have a suggestion.
Mm-hmm.
I think sometimes when we start talking about data trust and where data is stored and how it's stored and who uses it and steward, the basic conversation, in the sense citizen science, like education around data and data rights, sometimes gets lost, because even as somebody like me may feel like, okay, this is not actually for me, this is for people who really understand the law. So it's kind of exclusionary, and I would urge you all to see if you can help put together something which is simpler and digestible, which we can even translate, some partners, and start, or in other languages, vernacular languages, and start building that groundswell around understanding of data rights. I think it's a very important contribution.
It's a bit like starting from first principles.
Yeah.
Is hearing what Priya is saying and the way I would think about it. It's true. As you were, as the presentation sort of began, I was like, oh, this is utopian. When are we ever in India going to get to, a place where we're going to think about setting up data cooperatives and trust? But as we started to, have the discussion, it started to get more grounded, and you gave those examples, the fisheries project and the health group in Karnataka. So I feel like if you actually just sort of reversed the way you had these, the way you set up these discussions, you might actually be able to draw people in more easily.
No, absolutely. I think you're right. I think, and that's why we're trying to populate our work with as many real world examples as well to actually ground it in something more meaningful than just some high level ideas. But I think you're right, and I think that the process of discovery for examples in India continues. So if you ever come up with any sort of even communities that are ripe for this, I think just smaller discussions on like what does data mean for you, how do you view it, even those types of questions right now are so, I mean, I have no clue. There's not a lot of research on perceptions and the idea of like what is your personal endowment of data, what does that really mean for you.
Here's your research agenda.
Yeah,
that's a research agenda. It would be really interesting research to do.
Yeah.
Crowdsource response. All right, I have to go. Thank you, Quicksand team.
Yeah, I just want to take a quick minute to say a huge thank you to Astha and her team and, putting together such a great presentation. I think Sunita kind of hit the nail on its head, a lot of food for thought for many of us. And I think you also provided enough context for us to really think about how this impacts us in the work that some of us do back at Quicksand as well. So thank you so much, Astha. And of course, if anyone has any other questions, they could feel free to reach out to you on your email ID, or they could reach out to CoreNet and we'd be happy to relay those questions back to you.
Perfect. Thanks so much for giving us the opportunity.
Yes, of course. Thank you so much. Thank you. Bye, everyone. Thank you.
Thanks a lot.